So, I'm quite impressed also by the work they do to try to combine all the knowledge on products and product characteristics in kind of concepts that should be comprehensible for all of us. So I'm happy that Adrian is giving this presentation. I will give you also the micro. Yes. Just here.
Yeah. Okay. And I would like to start from the basis. So the change result mastitis. And I like this representation, not only because when I finalized my presentation, it was 38 degrees outside home. So I wanted to move close to an iceberg. But that was more because this is most often how farmers perceive the value of a mastitis. And they always see all the visible costs, but there is much more cost and losses associated with either short-term or extended lactation penalties. And when we look at the actual total cost of mastitis, hygiene is still relevant and prevention is still relevant. But how we can select product and program? Most often, very often, the common question we ask to a farmer are, which post-dip do you use? What are the active you like? Or whatever it is. But the question we should ask, we should focus on, is which contamination pathway route is driving mastitis in your farm? And then, when we identify this one, what is the best program we can implement in this farm to reduce? Products alone don't solve mastitis, but targeting do. So when it comes to advising hygiene during the milking, we can take this 4 steps to have something that can work. First, we need to identify where the contamination comes from. And this is one of the most important parts, to see what are the main pathways and where are the main risk hotspots. Then we can target where we need to put the focus in terms of hygiene. And during the milking, that will be 3 main steps, which are pre-milking, post-milking, and cluster disinfection, where we need to put our attention. Then, when we target, we can select different technologies. For each step, we can use different products that will have different behavior, different performance to really solve the issue. And the 4th steps is then to measure and to see if what we implemented on the farm is working or not, to do this follow-up. If we take the first steps, when we talk about hygiene, we can still use these 3 different contamination pathways, which are contagious, environmental, or mixed one, both contamination routes. These are still relevant because when we know this, we really can implement what will better prevent the mastitis infection in this farm. And the role diagnosis can lead to the correct product, but used in the wrong environment, so no results at all. And when we need to target our intention, so if we take the contagious pathway, we need to focus our attention during the milking with the post-milking and the cluster disinfection. We can also work on the pre-milking for sure, but if we need to really emphasize where we put our attention, that will be mainly post-milking and cluster disinfection. The focus will be mainly during the milking process. If we are more in an environmental pathway, the pre-milking hygiene, the other preparation, protocol, product, everything is where we need to put our attention. And then also working on the post-milking deep application, where the other between the milkings. Cluster case, still relevant, but not the main focus. And when we have a mixed pathway, we need to put all effort, so in post-milking, pre-milking, and cluster disinfection. And inside each focus, when we go to the layer of product, not all T-dips are the same. And a T-dip can be, by perspective, a combination of 4 characteristics. One is the active. In most of the cases, we are disinfecting, and we have several actives in the market, chlorhexidine, chlorine dioxide, iodine is active. Then we have in T-dips different emollient fraction. And we have some T-dips that will be better to improve the skincare, and other one that will be better for improving other things. Then technology. In some T-dips, we have dedicated technologies such as second skin around the teeth, or improving the skincare. And this is something we need to take into account. And then the application. We have several applications, and this is something to take into consideration. But what the science say about this difference in T-dip? We've been conducted with Sophie and MEX 2 different studies comparing the performance of T-dip in different conditions. And the first questions we wanted to answer was, are all post-dips equally effective under contamination pressure? And for this one, that one is in vitro simulated environmental contamination, 4 treatments were compared. 1 control, nothing, 1 iodine T-dip, 1 iodine plus this second skin technology, and the 4th one was chlorine dioxide, so a different active, plus this second skin technology. How the test was performed? So we are filling a cotton plug inside the calf rubber nipples. Then we dipped in each treatment this calf nipple, and then we were exposed all calf nipple to stray berries. And then, right after, collecting the cotton plug to assess what was the contamination in comparison with each treatment. And what was the outcome? We had, in terms of reduction of the exposure of the bacteria, if we compare all the treatments, so the iodine alone, so the control was our reference. The iodine control was 44% reduction in terms of contamination. The iodine plus this barrier 75%. And then when we changed the active with chlorine dioxide, that was even more in terms of decreasing the bacterial contamination. What is the conclusion we can take? Not all activities perform the same. So when we need to advise for T-dips, we need to really check what we are implementing, because they are not performing the same. The second question, we had 2 research questions. One was, is there a correlation between teeth skin condition and bacterial load? And the second one was, do products differ in their ability to improve teeth skin condition. So that was the two questions. So the treatment we were comparing, that was an in vivo on a conventional farm. The control was the TD in the farm, so that was an iodine barrier TD. And our testing product was an iodine-based product with more emollient inside. So the test was done, so the teeth skin scoring was done each 2 weeks during 12 weeks for both groups with this NMC guidelines. And then for assessing the correlation between the teeth skin condition and the bacterial load, swabs were taken after the milking preparation on the cows. So we had in one side for each cow the teeth skin condition, and then we were doing swabbing after the pre-milking preparation. And what was the results? So that was the control group. So we observed many differences. So that was each 2 weeks. A variation in the teeth skin condition. The blue line was very dry, the red one dry, and normal was gray. So the control group was really varying. But the other product is iodine with the high emollient fraction. We observe for this group really an increase in teeth skin condition. To end with most of the cows with a normal teeth skin. In terms of correlation between bacterial load and teeth skin condition, so that was for Staphylococci species, we observed that the more dry the teeth are, the higher amount of bacteria you have on the teeth. And that was also done with Streptococcus species, and the outcome was the same. So conclusion again, not all teeth dips perform the same, and we can see really an influence of teeth skin condition on the bacterial load on the teeth. But how does this look like in practice? So for a contagious pattern pathway, we have mainly cross-contamination. We have cross-contamination during the milking, so we need to put our attention in the teeth and the liner, the cluster, to avoid all this cross-contamination. What we observed with this study was for teeth skin condition increase the bacterial load, so we can work on it, and certain technologies can significantly improve teeth condition. So what does this mean on farm? We need to prioritize post-milking teeth conditioning disinfection, disinfect the cluster, that would be our main target, and then pre-milking disinfection. So if we take the 3 steps, we target cluster disinfection and post-milking with the right product, and then we can also work on pre-milking, but that will be in a second stage. If we take now the environmental cases, the contamination occurred between the milking, and we need to focus our attention in the pre-milking and the teeth protection. What we observe from the study is that some technologies can better prevent the contamination from the environment. So what does that mean when we need to target and select the product? We focus on pre-milking and post-milking, and we will have a clear focus on the protocol and the product you can use as pre-milking, for the post-milking, applying protection TDIP. And also work on the cluster disinfection, but this is not the main focus in that. And when we have this mixed pattern, so we don't know where the contamination comes from, but we have many mastitis in the air, we need to put our focus everywhere. So that will mean that we need the cluster disinfection, we need to put disinfection pre-milking and post-milking, and we can also add an additional technology post-milking with this protection. So what are the key takeaways from this? When we talk about hygiene during the milking, the right program, the right focus, not depend on the habit or active or product, but mainly on the contamination route. And we observed with these studies we did that some product types can better prevent contamination pathway. And always keep in mind that following these steps, identifying, trying to find where the contamination comes from, then target the intervention, because we cannot work on everything at the same time, then select the technology, and then measure to see if what we're implementing as hygiene is working or not. So this afternoon, during the workshop, we will work mainly on the three main steps, which are identifying. So we have a tool, a risk assessment tool, that we can feel to try to understand where the contamination comes from with data, with observation, and then targeting and selecting the product. So we'll have different not product name, the product characteristic we can select for doing this assessment. And thank you very much for listening.